Good evening and welcome to the Cancer Education Series. My name is Chris Goodale and I'm the Executive Director of Above and Beyond Cancer. The Cancer Education Series is brought to you by Above and Beyond Cancer and the Mercy One Richard Deming Cancer Center. So we're excited this evening to have Jordan Little with us. He is a DMU student and has been involved with Above and Beyond Cancer for years. Usually in this seat is Dr. Richard Deming, and we worked hard to try to get him connected. He's in Dallas, Fort Worth this evening. He had American Cancer Society meeting board meetings for the last couple of days, and it worked really well. All the technology worked really well until we desperately needed it. So pinch hitting for Dr. Deming and not doing a very good job so far is Chris Goodale. So Jordan, welcome.
Thank you.
And it's really good to have you here.
It's good to be here.
The topic of discussion, and we'll have many, but the topic of discussion is cancer from both sides of the stethoscope. So having never even had a stethoscope around my neck or in my ears, I'm going to defer to you to explain your cancer journey and how you got here, and then we can talk a little bit about the transformational journey that you went on with Above and Beyond Cancer, and get your perspective about medicine and cancer treatments and how your life and experiences have shaped all of that.
Absolutely. Wonderful. Well, I'll just start out by saying I'm very grateful for the opportunity to be here and just to share my experiences, my life, stories and things like that. And I mean, to start it all out, I just kind of say I'm a South Dakota born and raised kid. I grew up on a farm and in Watertown, South Dakota. I am the middle child of 6 siblings. So I have 3 older and 3 younger siblings. My 3 older siblings are biologic, and my 3 younger siblings we adopted from Russia when I was about 12 years old.
Wow.
And so quite the family dynamic over the years. But yeah, being a farm kid, I wouldn't have it any other way. So I could go off on a lot of stories in that aspect. But growing up, I was very involved in different athletics, a very avid soccer player. I swam competitively and started running track and stuff.
How large was the community growing up?
So Watertown is about a population around 20,000.
Okay, so your high school class was how big?
I graduated with 300. I'm going to say 300. Okay. It may have been a little bit less, but yes.
And Dr. Deming would ask, what was your high school mascot?
Oh, we are the Arrows.
The Arrows.
Go Arrows.
Wow.
Yes.
Okay.
It's a fun.
That's interesting.
Yeah. I like it. We had some fun high school traditions and stuff because Watertown was kind of close to a lot of Native American reservations and different cultural traditions that they shared with us and gave us a very unique culture in Watertown at our high school. But high school, I would say my junior and sophomore year, I started to kind of peak in my training for all of the different athletics that I was involved in. And going into junior year of high school, I had some unusual knee pains, and it was kind of just beyond the normal, just shake it off, stretch it out, keep on going. And so I ended up going to see a chiropractor. We started out with chiropractics, and they had a suspicion of like a torn meniscus, kind of on the fence. Could do some imaging, could refer to different specialties like orthopedics just to kind of get a better answer there. And my mom was very, very good in the aspect of like, we need an answer. Is he supposed to sit out for the rest of the season or can he keep going? And so
Moms can be really good medical advocates.
Yes, great advocate. I love my mom. So we ended up getting referred to an orthopedic specialist, and he was kind of following like same clinical picture. It sounds like a torn meniscus. the timeline would be sitting out for 6 months or so, just to kind of let things heal. And he gave us the option of like getting a confirming MRI. And my mom was like, okay, we gotta know. We just need to know. And we went in, did the MRI, and I actually remember the day very specifically. I was in, and this was after the scan. We were waiting for the results. I was in AP biology, and I got a phone call, or they called me out of class and said, you need to go meet your mom. They want to talk at the hospital. I was kind of confused, but I just went along with it because I was just a dumb high schooler at that point. And we were driving to the hospital to see the orthopedist. And I remember saying to my mom, like, something about this, like, doesn't feel right. Just a very, I don't know how to explain it, but a very strange premonition, kind of a feeling, weird feeling in my stomach. And we went into the office, and my dad met us there. He pulled up our scan, or my scan, and he, like, I remember the picture, and it just looked like Dalmatian spots all over my bones. And he tried to be very reassuring, which I appreciate so much. And he kind of gave us all of the differentials. This is what it could be, benign possibilities. We don't know anything about the specifics quite yet. We need to do a lot more tests. And so that kind of started the cascade of seeing different specialists, getting referred, getting a lot of blood work, a lot of labs. And we eventually landed on the conclusion of acute lymphoblastic leukemia. I shouldn't say it's a conclusion. It's more like the opening of a chapter.
Yeah, right. The start of the journey.
Yes, that was the start of the journey. And so leukemia, being 16 years old, is a very unusual experience. I think there's movies out there like A Walk to Remember, those really sad, tear-jerking movies. And I remember like almost thinking my life is going to be just like A Walk to Remember. And or like there was, I don't know, just playing out all the sad endings and everything. And so I remember feeling as though like there was something that I did to deserve it, or like I was trying to rationalize, how did I get into the place of like, I have cancer now. What did I do wrong? And it's a very limited perspective as a 16-year-old kid, and trying to rationalize my way through things. It created a very interesting dynamic with my faith. There's a lot of, like, I grew up in the Christian church, and there's part of me that kind of was wrestling with this idea. It was like, am I being punished for something? Is this like, what is my theology of suffering? Big questions like that a 16-year-old kid shouldn't really have to think about. And like, long story short, in that aspect, it definitely led to a much more like enriched experience in my faith. But aside from some of those bigger existential questions, it also kind of felt like part of my childhood was pulled or stripped away from me.
Absolutely.
Kind of had to grow up a little bit faster, and things like sports and other activities that I was involved in suddenly were not things that I could do. Like swimming, I wasn't, like, being in a compromised immune state. Couldn't be on the swim team, couldn't get in the water. And track, with all the medications that I was on, I was still able to run track. I was actually pretty proud of that. But my physical performance was significantly lower. And then there's all the mental games that go in with that. Like, I wish I was still improving. My coaches told me I was on track to make NCAA cuts and all this fun stuff. And it was like, now all of that is gone.
Yeah.
And it's wrestling with grief of grieving what could have been.
Sure. Opportunity lost.
Yeah.
Mm-hmm.
And
where was your treatment?
So we established care at the Sanford Hospital in Sioux Falls, South Dakota.
Okay.
The Children's Hospital, my castle.
I should know my geography, but how far is that from home? Growing up?
So Watertown is kind of in the northeastern part of South Dakota.
Okay.
And Sioux Falls is about 90 miles south of Watertown.
Okay.
So it was about an hour and a half drive for chemotherapy treatments and everything like that.
Yeah. So that's a commitment. It
is. And the nice thing about South Dakota is the castle is just an amazing place. They welcome you in. They try to make every accommodation possible. And they do a very good job of taking care of people and kids especially. And so that whole process, and it also helped having some family members in the Sioux Falls area for things like that. But it was a challenge trying to mentally prepare myself on those long drives of like, okay, another chemo day. And then we sit there for a few hours, get the medicine, and then we drive back and try not to puke. And my mom was the one who came with me to most of my appointments. And there was, I could go off on a lot of tangents about the things that my mom would do and say during those times. But one of them that I always come back to is she would just constantly remind me that this is only temporary. And she would say it over and over, it's only temporary. And like the first chemo infusion that I was getting, I remember the red, gross liquid looking stuff going down the IV tubes and straight into my arm. And I was having a lot of emotions, but my mom was the one who was right there and saying, this is only temporary and we're going to get through this. And it's just one step at a time. And so that became a very vital perspective, to just think of it as like, this is a season or this is a temporary experience. And in a lot of aspects, it helped kind of grow this feeling of hope. And I kind of made some promises to myself, like the best of my health is still yet to come.
Yeah.
And it may look different, like the idea of physical health, or like I might not ever get back to a sub 5-minute mile, but I can still take care of my body in other ways that I maintain this idea of health, emotionally and spiritually, in addition to my physical health. And so just keeping that, like it's only temporary perspective, really instilled a lot of hope.
A lot of support from your high school community and your neighborhood and those kinds of things, I would imagine.
They did all of the fundraisers.
Yep,
many. There were people dropping off food at our house, and I was like, Mom, I don't even know who those people are. And like someone anonymously gave me an Xbox for Christmas, and I was like, I don't had a gaming system. And so like just gifts that came out of nowhere, and people willing to share their time and their resources with us. There was a big fundraiser and stuff, and they were selling all the T-shirts and the typical things like that. And there was actually another individual who she was diagnosed around the same time that I was, with the exact same acute lymphoblastic leukemia. And she lived in a neighboring town in Clark, South Dakota, which is about 35 minutes away from Watertown. And our moms got to be close friends, fast friends, because we would try to schedule our appointments so that we could have a little bit of camaraderie there and go through some of those chemo treatments together. And we shared a lot of experiences, and it's and some other good things have come out of it, but it's a sucky thing to have in common with someone. But I find myself so grateful for the opportunity to have met that family and those individuals and made those connections.
Well, and as you said, it was relatively rare for someone your age.
Mm-hmm.
And I mean, statistically, to have two people about that age that in that close proximity is pretty astounding.
Yeah. And I mean, as I mentioned, like a lot of good did come out of the experience overall, despite all of the challenges. There's a camp that Sanford Children's Hospital puts on for kids with any sort of history with cancer, age 7 to 17, and it's every summer they spend a week at camp, and it's such an interesting dynamic that like all of these kids are brought together because of this awful thing that we all shared, or experience that we all shared, but it knits us together so closely that it's a family. And like thinking of all of the other campers as like my younger siblings, or kind of in that aspect, like I care for them the way that I would care for my other siblings.
Sure.
And I went to camp 1 year because I was 16 turning 17, and that was the age cutoff.
Right.
But I fell in love with camp just because everyone could feel like a normal person or a normal kid, and kind of escape the place where they might be the only one in their school where they don't have hair, or different challenges like that they would be facing. And we just kind of have all of this like shared suffering.
Yeah.
And I ended up being able to go back to camp as a counselor. So I've been trying to do that almost every summer now. And I think it's even better being on the other side of like being a counselor rather than a camper, because you get to sneak into the kitchen and get all the food. And
well, and the young people see you as someone who, well, look at that. I mean, to them, you're old. So they look at you and think, wow, this is great. Here's this old guy coming back to help us,
Right.
So that's a very valuable connection that they make as well.
Absolutely. And I can think back to so many conversations with some of the campers that, like some of them that I met my first year at camp, and they were 7, 8 years old. And then like over the years, as I've been their counselor, they still talk about that. Like, we remember you as a camper. Like, and just being able to establish that kind of a, like, well, someone like looks up to me, and they, I can be a role model. And despite the difficulties that I might be facing, like I can still provide a level of inspiration and
It's
hope.
a wonderful dynamic.
Yeah.
The energy goes both ways.
Absolutely. Yes.
So they diagnosed your leukemia from the spots on your knee.
Yes.
Because usually that's a blood test, right?
Yes. So my presentation was very atypical. They were not, like, there was no inclination. I had no weight changes, no loss of appetite, no fevers, all of the stuff that would kind of make you assume like, oh, maybe there's some sort of malignancy here. It was really just the knee pain. And then the MRI showed abnormal clusters of cells in my bones, and they went in and did some biopsies, and eventually came to the diagnosis of leukemia. And now that I reflect back on it, there were so many opportunities where we could have turned away, or we could have accepted an answer and said, okay, it's a torn meniscus. We don't need to worry about it anymore. And it does kind of make me realize just the amount of divine intervention that has kind of brought me to where I am now.
One
And
questioning. I mean,
Yep.
somebody, your mom in this case,
yep,
had to say, "Oh, wait a second, what? Tell us
Yes.
more about this, or what are our other options?" Or because so often we just sort of, and now you're on the other side of it, but we take what the doctor says and we sort of nod our heads and go home and
yeah,
go about our lives.
right. But yeah, my mom was a very, very big advocate. And
How long was your treatment period?
so it was about 3.5 years. I started
Wow.
chemo in September of 2012 and finished up in January of 2015.
And is that pretty typical of that
Yes. Yep.
regimen?
So I learned that males who are diagnosed with leukemia have to do an extra year because of just the way the body works.
Okay.
Whereas females only have to do 2.5 years. And so my partner in crime, she got to finish up early.
Right.
But it was like at that point, there's different like stages in the chemotherapy regimens. And once you get out 2 to 3 years, you can kind of resume a normal life and just slightly lower functioning or limitations. However you want to
So the
describe
rest
that.
of your high school years you spent going back and forth.
Yep. So junior year was a very weird year. I looked like I lost my hair. My weight changed with all the prednisone and gross other steroids and stuff I was on. And like I had to be home a lot, do a lot of home schooling, tutoring. My teachers were all very accommodating through that whole process. My senior year of high school looked a little bit more normal. And
You looked more normal,
yeah.
or the
So
old
hair
school?
started to grow back a little bit, and I was able to kind of I joined the track team or stayed on the track team, and I was able to still compete and
Okay.
eventually got back in the water. Just not quite at the level that I was.
Right.
And still I got to go to my senior fall formal and prom and
Okay.
able to do all of those fun things. And by the time I made it to undergrad, so did my undergrad at South Dakota State.
Okay.
No one would have suspected that I was still undergoing chemotherapy treatments. And it kind of felt like quite the bomb to drop. I remember my speech 101 class freshman year of undergrad, where they had us do an introduction, and you could hear a pin drop in the room when I told them my story and how I'm still doing chemotherapy treatments and everything. And that was actually the start of a lot of things, and kind of actually led to how I met Dr. Deming and some of the involvement there. But
so tell us that story. How did you and Dr. Deming find one another?
So I guess after this speech class, my beloved speech professor, Barb Kleinjohn, is an amazing human being and probably one of the most empowering and transformational experiences was in her speech class, where she helped me. So I was a very shy kid, high school, everything. Very introverted. But when I started that speech class, I was dreading the fact of I don't want to public speak. I don't want to do anything related to that. But she created a space in her classroom where it wasn't about wowing the crowd or impressing everyone. It was just a space where you could share an experience and a story, or just share something with someone else. And it wasn't necessarily a platform, but it was a level playing ground where everyone is this is an equal participation with the audience and with the speaker. It's not a one-way street. And so everyone, I loved that class. So I ended up continuing on in the Honors College, and I was a TA for her. So I became much more involved in the honors program at SDSU because of that. And then comes my junior year of undergrad, where I had no idea, but the dean approached me and said, "We have an alumnus who is looking for a student to take on a trip," and he gave us 3 standards: someone who is a pre-med student, someone who has a history of cancer or some sort of story with cancer, and someone who's in the honors college. And I think I was one of the only students who met all 3 of those. And it turns out that that alumnus was Dr. Deming, and he was looking for a student to take on one of his big trips. And so I was fortunate enough to participate with the Kilimanjaro team in 2017, where we summited Mount Kilimanjaro in all of its glory.
And you were 20?
Yes, that would be about right. Yeah. Yep. 1920.
By far the youngest person in the group, right?
I think, yes.
Yeah.
I believe so. And the other nice thing about it, my older brother, who is about 2 years ahead of me in school, he, like, I was kind of, again, still pretty shy. And the idea of going on a trip to another country with a bunch of strangers who I had no connections with, me being a South Dakota boy and everyone else was from Iowa or surrounding regions, I wanted to bring my brother along, and he was also a pre-medicine student. So we both went to Africa and helped out at the hospital there, and then we did that other week in Tanzania, climbing the mountain, and it was such a surreal experience to share with my brother, it in a lot of ways it gave a physical experience or physical representation to what I was experiencing emotionally and spiritually, with this idea of climbing a mountain and how it feels like there is way too much to go. Like there's no way we're going to get to the summit, or just all of the thoughts that come through when you're trying to climb something that looks so huge.
Right. False summits and
just over the valley. Oh, we got to go back down.
Right.
So it really gave a good, like, metaphorical kind of a representation for me to be able to just comprehend some of the emotions and everything else that I had been experiencing.
Your safety and care is in the hands of somebody else.
Yeah.
The Sherpas are leading you down a path that you've never been on, and you
they
don't know
where
how
they're
it's going
going
to turn out. Yeah.
Yes. And the summit experience. So this was after I had finished my chemotherapy treatments, and the summit experience was so, I'm trying to find the right word, and I don't know if I can find the right word. So satisfying, or so, I'll say satisfying, because all of the questions and all of the, like, do I have what it takes? Am I going to make it? Like, I'm sore. I don't really feel good. I don't really want to go any further. Do I have to? All of those questions came to a conclusion and said, I do have what it takes. And I do have the ability to put one foot in front of the other and keep moving forward and up. And
because you get up in the dark.
Yeah.
Right. 1 o'clock in the morning.
Yeah. So the summit night, or the summit climb, we woke up at 11 p.m.
Okay.
And then we climbed 8 hours to be at the summit by sunrise. And it was torturous. The winds were like 40, 50 miles an hour. It was minus, I don't even know how cold. All of our waters were frozen. We couldn't see anything. We had our headlamps on. It was just pitch black, and everyone was, it felt like they let us out into the dark to not come back.
Well, and I've read stories that, like, one woman said, I could only see out of one eye.
Mm-hmm.
And one person said, my entire side of my face is completely numb. I don't know if it'll ever be, feeling again. And
Yes.
but yeah, you kept moving on.
Keep on going. And so there is all of those physical concerns of like the high altitude cerebral and pulmonary edema that can result. And Kilimanjaro is 19,000 feet. And so very common for those complications to come up. And like me having a little bit of like an undergraduate kind of medical background, I was like, oh, that sounds really bad. I really hope that doesn't happen to me. But just getting to the other side of it and then getting to the summit and looking down and seeing all of the places that I've been, that was an indescribable feeling, and a very accurate representation of how I can look back at my cancer journey now and just say, I can't believe I made it through all of that. And I can't believe all of the things that I've experienced, and just being on the other side of it now is a very sobering perspective.
Well, and in some ways, we just, instead of taking a step forward, the nurse comes with the next bag of chemo or whatever, and there's no consideration.
Right. Yeah.
I mean, nobody ever says, "Well, it's up to you." I mean, it's just they have the plan, and you just go right with it.
Yeah. And I guess being on that summit also helped me realize a lot of other things and where I wanted to take my life.
So you were a junior at South Dakota State.
Yes.
Did you already know medical school was in the future?
Yes.
Not which school. You were probably still having to apply to schools.
Right. So my older brother was applying to med school at the time. And so I kind of already knew that I wanted to follow his footsteps, and that was kind of the goal. But I think being on the summit was something that solidified it for me, because of the realization that I can't stay on the summit. Otherwise I would die. But I have to go back down the mountain. I have to go back into the valleys. And like on that way, like the descent back down from the mountain, we would see people who are on their way up the mountain, and just encouraging them, like, you guys, it's so worth it. You're going to it's going to be amazing. Just get ready. And having that sort of a testimony to give other people hope and say, like, this is something that you can do, and just take it one step at a time. That was something that I took with me into like my how I want to shape my career, and how I want to work with patients who have been feeling or experienced just so many different pain, ailments, experience, like traumas, and how like having some sort of shared suffering or shared experience of pain. It might not look exactly the same, like someone else who's had a traumatic experience versus a cancer diagnosis. They don't naturally overlap.
Right.
But emotionally, you can experience, like, I've experienced grief, I've experienced loss, I've experienced pain and suffering, and those elements are things that we can build empathy with each other. And I remember Dr. Deming speaking a lot about this idea of compassion,
right,
and hearing him define it and talk about it, and just the way that it's this idea of co-suffering, or being willing to suffer with someone else. That was something that I wanted to be able to do, and be able to do well, because you hear all about, like, we want to be compassionate physicians, and most of the time people don't even know what that means.
Right. Yeah. So great words, but not necessarily always great actions. But that's the old saw, that the best doctors and the best nurses have been patients.
Yeah.
At some time, and that changes your perspective. And you had that from the very beginning, but not everybody does.
Right. And I'm at a point in my education where I've interacted with enough patients, and where the topic has come up, and I don't it's not something I walk into the patient room and say like, hey, I had cancer too. Like,
Right.
no, you build the rapport and you build the relationship and say like these are things that I've experienced. I don't know exactly what you're processing or experiencing, but this is what I felt when I was in a similar
That's
place.
so valuable.
Mhm. And
So you
just
graduate from South Dakota State. How
Mhm.
did you get to DMU?
Oh, yes. Okay. So I applied to 4 schools, all DO schools, Des Moines University, Kansas City, VCOM in Virginia, and then Lake Erie, Pennsylvania. And I was between VCOM, where my brother was going to school,
Yeah. Okay.
and Des Moines University. And I ended up choosing Des Moines University because it's closer to home,
Yeah.
and it's about 5 hours back to home. And I just having that had been so integral in my cancer journey. I needed that support system
Oh, yeah.
for school, and kind of just being off on my own in Des Moines was a little scary. And so having some
Sure.
sort of way to get back home was important to me. And then also the connections and the relationships from the Kilimanjaro team just kind of made Des Moines seem like the right choice and the right place for me. And I think it was the right decision so far.
And where are you in your medical education?
Yes, so I have finished my 3rd year of med school, and then currently I'm doing a full year of an undergraduate fellowship program at DMU, and so it's an osteopathic manual medicine fellowship, and so I get to spend basically part-time in the OMM clinic at DMU, learning.
Okay, so OMM
Yes,
is
OMM, so osteopathic manual medicine.
Okay. Yep.
If any of my preceptors see this, they're gonna criticize how I describe this. So we are, as DOs, or doctors of osteopathy, we are trained to practice in any field of medicine, do any specialty, any procedures, just as any other doctor would.
Mhm.
However, we have this additional training to use our hands to diagnose and treat different twists and turns in the body, or dysfunctions that may be causing or contributing to the symptoms that a patient is experiencing.
Okay.
So a lot of body manipulation kind of therapies, specifically learning how to diagnose and then treat something with our hands. In addition to all of the like normal medical regimen that you would.
Pharmaceuticals. And,
Right.
Yeah.
Yes. And so this year I'm spending in the OMM clinic working with some amazing physicians and just learning how to refine those skills of diagnosing and treating with my hands. But then I also get to teach the 1st and 2nd year students in
fun.
their lectures and their labs. And that's been a really fun dynamic, because I similar to camp, like I've been through 1st and 2nd year. I know how awful it is. And being on the other side of it, I can kind of be someone, or a voice of hope, that it does get better and things like that. So I have thoroughly enjoyed this fellowship. And after I finish, and there's about three weeks left of it,
Okay.
I'll go on my last year of rotations, then graduate from DMU, and then residency, and then wherever the wind takes me after that.
Yeah.
So.
And where would you like to specialize?
So right now, my thoughts are to go into ONMM, or osteopathic neuromusculoskeletal medicine. So quite a mouthful.
Yeah.
But it's essentially just a specialty where I get to diagnose and treat with my hands, and work with a lot of neuromusculoskeletal issues in patients who have chronic pain, acute pain, different sort of we can work with any patient, but the main part of that specialty is that we focus on using our hands to diagnose and treat and help their symptoms in that way, in that capacity.
And did you consider oncology?
I did. And the thought process that went through my head was, I think it would be a little bit too emotionally close to home. I do see myself working with oncology patients, but I don't necessarily want to be the one who is administering all of the medications and drugs that I had to. It feels something about it doesn't feel right.
Yeah.
But the place in my heart is I want to work with patients in that background and help them or help alleviate some of the symptoms and the complications that come from all of the different treatments and everything.
Yeah, you'd have an acute understanding of that too. That'd be excellent.
So
did you think about pediatrics?
I did.
Based on your history as well?
Yes. It's been a long kind of process of trying to figure out where I want to go. I was thinking med peds, pediatrics, family medicine, all across the board. Not really sure how or where I wanted to end up, but I know that I want to work with kids. I know that I want to work with cancer patients. I know that I want to work with adults as well. And so I also know that I really want to work with my hands. And going into OMM or ONMM is a place where I could potentially work with all of those populations, whether that be in a private practice or a consult service in a hospital, or, Dr. Deming was just sharing about setting up his kind of outpatient clinic and having some more alternative and different types of management of patients. And,
comprehensive care.
Yeah. And so I firmly believe that there are plenty of opportunities for me to find my niche and be in that place where I can work with kids, work with cancer patients, work with adults, and use my hands to help them all.
And is that a specialty that's widely known? Would you have opportunity anywhere in the country to go, or are there certain areas where it's more popular or more plentiful?
Yes. So there are definitely hospital systems that are more like DO or osteopathic friendly. The unfortunate reality is that a lot of DO, you can't really tell the difference between a lot of DOs and MDs. And there's a lot, that's kind of a whole nother conversation, because a lot of DOs aren't necessarily using manipulation the way that they were trained, and it's kind of just a lost art. After you go on your rotations and residency, it kind of just gets to be something that you didn't get to practice as much. So you don't use it if you don't practice. But they're how do I say that? There is a need, and it's kind of becoming a growing need that a lot of patients are asking for. What else can I do? What other options are there? How else can I get the help that I need? And I do see that as something that won't be an issue career-wise. But I guess finding the right hospital system where so there's kind of a negative connotation sometimes where people think, oh, they're just fancy chiropractors. Not necessarily. And we do have the full medical education background. I do understand how to prescribe medicines and work.
And knowing that may be the right choice at some point, but there's alternatives sometimes.
And so my approach to a patient is still rooted in an understanding of medicine and an understanding of their medical conditions. My treatments and the manipulations that I do would be directed toward their medical diagnoses.
Mhm.
Whereas different body work specialties like chiropractics or physical therapy or massage therapy don't necessarily have that extensive medical
Right,
diagnosis
the sort of
training.
the deep understanding and deeper. Yeah.
Right.
And would you anticipate that you'd stay here in the Des Moines area, or?
I don't know.
Yeah.
So the residency programs that I'm looking into, they're kind of not in Des Moines. There's one in Missouri, and Michigan and New Mexico and Virginia, and so they're kind of not here. And I don't know what my next steps would look like after that.
Okay.
If I end up coming back to Des Moines to establish some sort of a practice, or
Right.
going all the way back to South Dakota and being closer
Oh
to
yeah,
home.
sure.
But yeah, it's kind of a wide open territory, and I'm just here for the ride.
So how has your background and your cancer journey motivated you in medical school, or that trip up the mountain? Has that
Yes.
been something that you have resorted to thinking about as it's 3:00 in the morning and you're still reading, that text that is due soon?
Yes. Yep. A lot of medical school is very difficult, and I find myself frequently coming back to my why. Like, why did I want to put myself through all of this school and all of these tests and all of these anxiety-inducing things? And sometimes it's difficult to remember that why. Like, I could have just been a farmer, or
Right.
I could have stayed close to home and started a pottery shop business, like all of these different things. I play the what if game a lot, but my why comes back to my I want to help people, and I want to see people reaching a place where they are living their life as best and as fully as they can.
Mm-hmm. We talk a lot about optimal living.
Yeah. Yep.
Which is kind of a hard thing to define, but you know it when you see it.
Right.
Mm-hmm.
And I have no doubt that I could have been able to help people in any other careers.
Yeah.
But I like science. I like learning. I like applying and using my hands, and I like problem solving and working with complex things and cases, and trying to figure out what more I can do to help this situation. And so medicine and working with patients and working with people in their medical conditions just seems right.
Mm-hmm.
And I know that I know that I have what it takes to be a good physician. And even on the days where I didn't do well on the test, or I didn't whatever the difficulty may be, I come back to this idea that I have what it takes to be someone who can care well for someone's health. And I think in healthcare, that is a lost art, how to actually care about someone's health, rather than just put them through an algorithm and say, this is a treatment that you should be going through, and good luck.
Right. Back to that problem solving.
Yeah.
That's the easy part sometimes, to just say, well, this is the way we do it, instead of really analyzing the bigger picture.
Yep.
What are some ways we could handle it differently, maybe?
Yeah. And just having an understanding of each patient background, and how every patient has a different experience in life and a different experience with their medical conditions. And they each need an individual like plan. Like there's no
Right.
one size fits
Yeah.
all in medicine. And I think using my hands in that capacity gives me a very special and specific ability to listen to a patient's body and help them navigate that, like whatever is going on in their body. Um, so yeah, I think everything just seems like a good fit, and I don't know how to explain that.
Yeah.
But my why is more so that I come back to this idea that I do have what it takes. I do have the ability to be a good physician or a good whatever. And it's not necessarily my qualifications or how I do in school,
Right.
but it comes back to my ability to build empathy with
Yeah,
someone
that's
and build
the
a
word,
connection. So, yeah.
So what in our live studio audience do we have questions?
Can you hear me?
Yeah.
Okay.
Okay.
Jordan, congratulations. Most of us have watched Dr. Deming and want to be compassionate like him, and we don't learn it, and we just struggle with it. But just from listening to you, you are there, and you'll make a great doctor.
Thank you.
And what a compliment to Dr. Deming that you have followed his footstep in compassion.
Yeah. Thank you.
I have a question. I just recently, last week, dodged cancer for the actually third time, I guess, and the other two probably will never reoccur. But each time, particularly the last two, when I did have cancer of the breast, and then the last one was maybe lung, but it isn't cancer. And I became absolutely terrified. I mean, I just was absolutely terrified. I went to meetings I wasn't even scheduled for, and I, was probably not capable of driving. Did you have almost debilitating fear, and how did you handle that?
Oh,
I mean, I just fell apart.
yes. Okay. I love that question. Thank you. I do have a lot of anxious tendencies. And fear was a very large part of my journey. Being 16 years old and being faced with questions like, am I going to be able to have kids? Am I going to be able to graduate high school? Like, just being afraid of the unknown in a lot of sense. And I have found that the opposite of fear isn't bravery or courage, but it's knowing how deeply I'm cared for, how deeply my mom and my dad care for me, or how deeply my friends and my community cared for me. And this aspect of love and whatever does happen, there will be people who care for me, who meet me in that. And so the opposite of fear is not bravery or anything, but it's actually finding how much you're loved and how much you're cared for, and that no matter what happens, there's people who will be there. So, does that answer your question?
It sure does.
Okay.
You're remarkably
Yeah.
Thank you.
One more question, Tim.
Oh boy, Jordan, you have the greatest background I've ever heard,
Oh,
and what you're doing now and your future looks very bright.
thank you.
If you looked over here and you saw me, if it looks like I was tearing and stuff like that, no, really, I do have something in my eyes. I am trying to scratch it out. Okay, but what I want to say is that and you stressed this a lot during your presentation tonight, is that you've been through it when you're young, right?
Mhm.
You've been through that mountain, in your teenage years. And guess what? There's another mountain in front of you, Kilimanjaro. You went through that, you climbed that, and you did it, and you succeeded. You have these mountains and valleys of succeeding, and then, going back and saying, okay, what do I do next? I need to climb my next mountain and succeed. And guess what? You're climbing up the next mountain, and you are going to succeed.
Thank you.
Well, this has been great. We sure appreciate you sharing your time, and you probably have to get back and study, right? Yeah.
Unfortunately, yes.
So this will be available. It's been recorded this evening, of course, and will be available on the YouTube channel for Above and Beyond Cancer. And it will also be available on the Mercy One Deming Cancer Center website as well. So we appreciate everyone joining us this evening, and we look forward to you joining us again next week. Thanks, everybody.